was my heartbeat. She was meant to be here, you know. I remember the first time she done my hair, I said, Tia, you got some talent there.
Tia Wilson loved to sing, braid hair and do anything creative. That's when she was feeling well, but in the last few years of her life, her mental health deteriorated. It was at those times that her mum tried to comfort her.
It wasn't nice to see her in pain, and I couldn't do anything to help her. I couldn't get into her head and say, oh, look, Tia, I just wanted to take away all the pain, and there's nothing I could do, it's just to be there, hold her.
When Tia became extremely unwell, she was taken to A&E and detained under the Mental Health Act. At 18, she was the youngest person on the ward. Her mum visited nearly every day, but there was one day when she didn't. What happened in the morning?
She called me and I said to her, T, I'm going to come down and see you tomorrow, which was the Sunday, because I wanted to surprise her and bring Grandma down. But like, she still sounded quite, you know, highly medicated, but in monotone. She was like, okay, Mum, I'll see you tomorrow. The funny thing is, that day I felt very on edge. I don't know why. I couldn't place why I was feeling the way I was feeling. Little did I know that Tia had passed away around 1, but I didn't find out until something to 11 at night. Yeah.
How did you find out?
I was driving to Mum's and the phone had rang and I was just pulling up, so parked up, and the phone rang again, and it was somebody from the hospital. They called me and said, hi, is that Sharon? I said, yeah. He goes, oh, hi, there was an incident. I thought, oh, well, maybe there's something that happened, maybe with another patient. There's been an incident and unfortunately your daughter's passed away. And I'll never forget that conversation. I can hear those words as clear as day. I'll never forget that. And I just remember just jumping out my car, just banging on the door, and I said, Mum, she's gone. I said, she's gone. I was not expecting to get a call to say that my daughter had passed away. She was only in there 11 days. 11 days.
Tia Wilson was in the care of the South London and Maudsley Trust when she took her own life, aged just 18, on the 21st of August 2021. At her inquest this year, a jury found multiple failures, including insufficient numbers of staff to take care of her. While the Trust also admitted there was a lack of observation and inadequate records kept, she was down for one-to-one care. That decision was reviewed in the days leading up to her death, but not properly noted down. The charity Inquest, who support families investigating state-related deaths, have raised concerns. What is going on in this particular trust? Do they have an issue here?
We have some very concerning deaths at the moment involving South London and Maudsley Trust. And since 2014, we worked on at least 39 cases involving this trust, 3 of which have resulted in neglect finding.
Who needs to be accountable?
I mean, it's not the individuals, you know, and we saw at the inquest, you know, some of the individuals who were in charge of Tia's care were really visibly upset. But I think it's the senior management at the trust that needs to take responsibility. And also, there needs to be a proper statistical information about deaths coming out of our units, because at the moment there is no publicly available data.
Here's what we do know about deaths at the South London and Maudsley Trust. From 2018 until now, there have been 6 suicides by inpatients on wards, including Tia, and 8 suicides by patients away from a ward. In the community, 119 patients took their own lives. Across England, in the year of Tia's death, the CQC has registered at least 50 other such deaths of detained patients. In a statement, the Trust said,
We sincerely apologise to Tia's family for not being able to keep Tia safe from taking her own life. Tia's death has deeply impacted our staff, who are absolutely committed to caring for the people who use our services. We have taken much learning, including introducing daily clinical care meetings to ensure engagement and observations are reviewed within a multidisciplinary team.
What do you want them to know about what they have done to you and your family?
I'm broken. I'm hurt. I'm not going to have any grandchildren. I'm not going to see her get married.
For Sharon Wilson, no apology could ever be enough for now living without her only child.